Bernese Mountain Dog and Canine hip dysplasia. Hip dysplasia is a common condition that affects many dog breeds, including the Bernese Mountain Dog. In this article, we will explore the causes, symptoms, and treatment options for canine hip dysplasia in Bernese Mountain Dogs. What is canine hip dysplasia? Canine hip dysplasia is a genetic condition that affects the hip joint in dogs. It occurs when the ball and socket of the hip joint do not fit together properly. This leads to an abnormal development of the hip joint, causing pain, lameness, and eventually arthritis. Causes of canine hip dysplasia. Hip dysplasia is caused by a combination of genetic and environmental factors. In the case of Bernese Mountain Dogs, the condition is thought to be genetically inherited. Therefore, it is crucial to choose a reputable breeder who conducts hip screening tests on their breeding dogs to reduce the risk of passing on the condition to future generations. Symptoms of canine hip dysplasia. The symptoms of hip dysplasia in Bernese Mountain Dogs can vary in severity. Some common signs include 1. Limping or bunny hopping gait, 2. Difficulty getting up or lying down, 3. Reluctance to climb stairs or jump, 4. Stiffness after exercise or prolonged periods of rest, 5. Decreased activity level, 6. Loss of muscle mass in the hind legs. If you notice any of these symptoms in your Bernese Mountain Dog, it is essential to consult with a veterinarian for a proper diagnosis. Diagnosis. To diagnose canine hip dysplasia, your veterinarian will perform a physical examination and may recommend imaging tests such as X-rays. X-rays can help evaluate the hip joint for signs of abnormality, including loose or malformed hip joints, hip subluxation or dislocation, and the presence of arthritic changes. Treatment options. The treatment for canine hip dysplasia will depend on the severity of the condition. Some common treatment options include 1. Medications. Nonsteroidal anti-inflammatory drugs, NSAIDs, can help manage pain and reduce inflammation in the hip joint. 2. Weight management. Keeping your Bernese Mountain Dog at a healthy weight can help reduce stress on the hip joint. 3. Physical therapy. Rehabilitation exercises can help improve muscle tone and range of motion in affected dogs. For joint supplements, glucosamine and chondroitin supplements are often recommended to support joint health and reduce further degeneration. 5. Surgical intervention. In severe cases, surgery may be necessary to improve the dog's quality of life. Procedures such as femoral head ostectomy, FHO, or total hip replacement, THR, can be considered. Prevention. While it may not be possible to prevent canine hip dysplasia entirely, there are steps you can take to reduce the risk. 1. Choose a reputable breeder. Ensure that the breeder you choose conducts hip screening tests on their breeding dogs. 2. Avoid excessive exercise in puppies. Too much high-impact exercise at a young age can contribute to the development of hip dysplasia. 3. Maintain a healthy weight. Obesity can worsen the symptoms of hip dysplasia, so it is essential to keep your Bernese Mountain Dog at an appropriate weight. 4. Provide joint supportive supplements. Discuss with your vet about adding joint supportive supplements like glucosamine and chondroitin to your dog's diet. Conclusion. Canine hip dysplasia is a common condition that affects Bernese Mountain Dogs. While it is a genetically inherited condition, steps can be taken to reduce the risk. Early diagnosis and appropriate treatment can help manage the symptoms and improve the quality of life for affected dogs. If you suspect your Bernese Mountain Dog might be suffering from hip dysplasia, consult with your veterinarian to determine the best course of action.